It is time to reimagine leadership. My name is Ben Owden, and I would like to welcome you to a series of conversations in partnership with WomenLift Health around how can we develop new approaches to the new challenges that leaders face in the 21st century. Greetings to you. I hope you are doing well and are having a meaningful and productive day. Welcome to another episode of the Why Lead podcast. I'm your host, Ben Owden. Now, in partnership with WomenLift Health, we're hosting this series of conversations around reimagining leadership. How do we develop and apply new approaches to new challenges that are emerging in leadership, particularly in the healthcare space? And today we'll be having an interesting conversation around AI. Now, I think if you live in the 21st century and you have access to internet, you are aware of all the different things that are happening around AI and how they are revolutionizing how we live. In fact, prior to this conversation, I just saw that Microsoft released a tool that you put a prompt and then it creates a song for you. So crazy things are happening every single day. But I think an aspect of our life that will also be disrupted by AI is healthcare, how healthcare is approached, how medicine is developed. In fact, I think 10 years from now, probably when you go to the hospital, if you want sort of like a general diagnosis, you'll probably be dealing with an AI system or a robot or something like that. So a lot of things are happening around that space. So how can we create a sense of inclusion in the space around AI for women? Because healthcare affects everyone. And so everyone should be in that conversation, in that room, on that table to make decisions, to create products. And so to have this conversation, I am joined by the Managing Director and Health Systems District Leader for Philips East Africa, based in Nairobi, Kenya. She is responsible for the overall Philips operations and the business growth agenda in Eastern Africa. Throughout her career, she has gained vast experience working across different healthcare systems and has played an active role in training healthcare personnel. In addition, she has held senior leadership positions in healthcare organizations for over a decade, where she has leveraged her knowledge and expertise to promote digital health and drive innovation in the industry. Ladies and gentlemen, Dr. Muthoni Ntonjira, karibu.
Asante, thank you very much.
I guess my first question is, how did you find yourself in the health tech space? I think most people are in the public health space.
Yes.
Most people are practicing maybe in hospitals.
Yes.
But health tech in this time in Africa, how did you get here?
Thanks, Ben, for that question. I've had a very interesting journey in my career. Started off as a medical officer working in the public sector. And thereafter did my residency in anesthesiology and critical care and worked in a rural hospital in Kenya for about 3 years as a consultant anesthesiologist. At the same time, I was working as an intensivist. An intensivist ideally is a person who is a specialist in critical care and will manage patients in the ICU. And interestingly, I also worked as a part-time emergency flight physician. So I've been in little spaces in various parts of the healthcare system in our country. I then worked as a medical director for the Kenya Red Cross, and primarily my work was in emergency care and setting up systems, medical protocols, and ways of working within the pre-hospital space, with a focus, of course, in trauma and managing emergencies. Then I did, because a lot of my work also meant I had to ensure that we have a sustainable business, that generated an interest in getting to understand healthcare as a business. And so I did an MBA in healthcare management. And got to also interact with different players in the industry. And one of those players was Philips. So my relationship with Philips actually precedes my joining the organization, because at the time I worked in a campaign for about 3 years, where I developed that interest in getting to know. I'm using the solutions created by this global health tech company, and an opportunity came where I could join them. So based on my passion of creating impact in my work, or at least having some level of impact, whether it's at a small scale or a larger scale, I felt I needed to join an organization that is driving impact at a much broader scale as opposed to the one-on-one patient interaction that I was having. And thank goodness, it's one of those things where the stars aligned and I got an opportunity and managed to join Philips. Initially as a country manager within Kenya, but later my scope was expanded to support Eastern Africa. And then based also on the fact that now I'm looking at a broader spectrum of digital solutions cutting across the entire continuum of care, I've just enrolled in a PhD program in healthcare management, with my focus being, my dissertation is focused towards looking at how digital innovations and digital solutions have transformed healthcare within Eastern Africa. So you can see the journey has been gradual, with many interactions within different spaces within the healthcare system. And I'm really glad that I get to do what I am very passionate about.
I personally love stories like yours, specifically because of how at times chaotic it looks.
Yes.
You were doing here, you did this, you did that. But actually, I recently read a book called Range, how generalists triumph in the world of specialization. And there's a concept that he talks about in the book, which is how sometimes we tend to pick a career path or pursue a PhD at the age of 22, but actually you haven't sampled enough to figure out specifically where you want to be invested for the long term, right? And so the book advocates for this idea of sample for a while, do everything, explore different things until you find something you like. And it looks like from your story, that's exactly what you did. There was a lot of sampling, did a lot of interesting things.
Yes.
It would have been interesting to know what it's like to be, a doctor on a flight. But
it was some of the most adventure I've ever had in my career. But it was interesting.
So thank you for doing that and for having more examples of people who make those decisions early on in their career. And then, now you can specialize later on and you're not late. There's not that sense of haste of like, oh my goodness, why didn't I do this at a much earlier stage? And I think talking about technology and health tech right now is a very relevant conversation because of what's happening around AI.
Exactly.
And I think people like yourselves are probably going to be at the forefront of what that looks like in our continent in Africa. Now, as AI continues to shape the overall landscape of global innovations, how do you envision, the sense of equity and inclusivity being the integral components of AI tools? Particularly, how do we address how do we use AI to address the diverse healthcare needs that are there? And how do we get women into those rooms where these conversations are being held, where these products are being developed, where decisions are being made? How do we get to that point?
Very good question. And one of the key things about AI is also trying to create equitable healthcare access. And whenever digital innovations are being created, AI has a potential to be able to put together data sets from diverse populations. And this also will help to remove that bias when you're creating the algorithm that can be biased towards a particular cohort or a particular population. So, and this is something that I appreciate about Philips, is that the data collection points are in diverse populations so that there's more inclusivity in the data or the protocols that are being developed. One of the examples I want to give is we have a collaboration between the Bill and Melinda Gates Foundation and Philips in developing an portable ultrasound device that is AI-enabled. And the data and research is being carried out in a primary healthcare facility in Kenya. So that tells you that the data sets that are being collected, the users who are part of this research are actually local and healthcare providers and the local patients who are being used. And for this tool that is being developed, the target population is low and lower middle income countries where there's an issue of access. And therefore, if you're using the correct data sets, you're developing the algorithm based on the population that is intended to use a device, then there's a lot more inclusivity. On the question regarding women, and how do we bring in women as to be part and parcel of this process, is that we need more women to be decision makers within healthcare. And the statistics are out there that the bigger consumers of healthcare are women. But unfortunately, the much lower population or percentage of decision makers in the healthcare space are not women, right? So we need to bring a lot more women into decision-making positions within healthcare. And if you have the women driving some of these processes, then at least you're also going to bridge the gap and the gender gap that is created when you don't have the right people or you don't have involvement of women in this particular processes. Another aspect that I want to bring out is when you're addressing agenda bias and you actually bring in the marginalized group, which is the women in this case, then you will also have a focus for the women to look at the priorities and needs that the women have within or for women health, right? So you will not have, the priorities will be aligned according to what is felt is a need for the women, or at least the tools that are being developed will be solving a solution where there is a need. And then secondly, you will have the consumers of a product being the ones who are making a decision on that solution. It is very, if we even move away from healthcare, if you're developing, say, a mobile app, and it is geared towards a particular demographic, the people who will be part of the development of that app will be part of that cohort that is being targeted as the users, isn't it? So the same should be for healthcare. So if we're designing tools that are to be used for women, women should be part and parcel of the decision makers within that space, right?
Thank you for that. Something you mentioned there, right? Where the biggest consumers of sort of like any healthcare interventions and anything that's rolled out from that front are women. But we also know the majority of the players in the healthcare are women, around 70%. But how many of them are decision makers? That's a whole different conversation, right? Yes. Where the number there suddenly decreases. And something that I hear quite often, and I remember this one time I was in a room and there were two other women in there, and they hold high positions in their organizations. And they asked me, Ben, do you have imposter syndrome? And it led to a very interesting conversation. Yes. And then one of the things that were said was that it seems like more women experience this sense of imposter syndrome. And sometimes it can have a crippling effect where nothing is done. You don't raise your hand, you don't speak up, you don't champion, you don't advocate. And then, of course, on the other hand, it can be something that puts, fire under your seat and you just are always on the go. So I guess in your case, I'm sure you've experienced this or you've seen it happen, doing what you do and being a woman doing what you're doing. What are some of the self-limiting beliefs that maybe people usually have that if they find a way to overcome, it will unleash their potential?
It's good you spoke on imposter syndrome, very important. And I feel a lot of times the way we can be able to mitigate the imposter syndrome is to be able to provide a platform that is inclusive and educate even from a much younger age. I always say charity begins at home. Science or science-oriented subjects have traditionally been pushed towards the boy child. But I know now there's a lot of affirmative action and drive towards encouraging girls even from a much younger age to take up science-related subjects, right? So when we say charity begins at home, let's start from a much younger level, so that we're not dealing with an adult, a female or a woman who's already in the workspace and has that self-doubt on whether she has the capacity or the capability to handle a certain task or take up a certain career path or even an opportunity offered within the organization because she doesn't feel she is capable. But if we start pushing the girl child from that young age, I think that's one of the ways of tackling that imposter syndrome. So that we provide an environment, and not an environment that excludes anyone. Encouraging the girl child does not mean that you exclude the boy child. I think it's just a matter of providing an environment that also pushes the girl child from a much younger age to create a passion towards this science-oriented subjects or science-oriented career, and show them that you can actually do anything that you set your mind to do if you have an interest in it and if it's a passion that you actually have. So that when they get into this workspace environment, then you'll be dealing with less of an imposter syndrome, and you're actually dealing with people who are within a space that they're passionate about. Then the other bit is I think there has to be a very intentional drive from leaders or decision makers within an organization to include women. Whether it's a gender quota that's created or whether it's an intentional move at the point of recruitment to ensure that there's a gender quota that is met. So if I find, for instance, that I'm applying for a role where I might be the only female and it's a male-dominated environment, then it becomes, I might start, having that element of self-doubt on why am I the only one? Am I really capable of delivering on this, especially in tech-related jobs? So if we create an environment that I see someone who is like me in this space, I'm more motivated to actually push myself to get myself into those tech-related fields. So I think if we also have decision makers at a higher level who at the point of recruitment make it an intentional move to include women, either have a certain quota or ensure that in their shortlisted candidates, like we had this morning, shortlisted candidates are include a certain percentage of women, by merit, and then also ensure that within a certain department you have a certain proportion of women. So it's not a field where you're checking a box, and if you have one female, you've checked the gender box. If you have maybe a certain minority group, you've checked another box. I don't think that's the way to go. I think the way to go is to ensure that you make an intentional move to have a certain representation of all the diverse groups, so that in that way, when you have a diverse team, you also have diverse opinions. And I feel whenever a team is more diverse, it works better. And you have ideas and solutions and innovations coming from a diverse group, because I will be looking at things from a different aspect from the way you would be looking at them. There's a very interesting example that was given, that sometimes what a man might feel is a priority for women's health, coming from a woman might be very different. Because the consumer of that healthcare service knows best what they need, just like in any other product.
Wow. I like a lot of what you said there. And I'm like, there's questions running through my mind.
Yes.
But I think specifically, I would like to, speak about representation. Saying it, representation is very powerful. I think when you see yourself in a space because maybe there's someone who resembles part of your identity, so to speak, it can be a very powerful force that drives you forward as well. And I think when we talk about AI and tech and health tech, what are some of the opportunities to network for women in this space? Because visibility is important. And I think I'm trying to think right now, if there's a young girl who, let's say, is in high school and, they want to pursue health tech and do very interesting and cool things in that health tech space. Where do they start? Where do they network? Where do they meet women? Where do they see these women who sort of resemble who they are? And sometimes it's how they look, and it's like, I see myself in there. If she's there, then I can probably get there. What are some of the networking opportunities, but also maybe a challenge as well for women who are in that space to be more visible, so that representation is felt across the board? Yeah.
One of the things that I really speak to, and you asked a very good question, is mentorship. Yeah. And this one is a challenge actually to all women who are within the space. I think where we have not really focused on is how do we mentor the younger generation of women to actually venture into STEM, right? And if you're within an organization as a woman, regardless of the number or the percentage of women you have there, it is imperative that you also make sure you are mentoring another generation of women who can be inspired to do what you do. And mentoring is in very many ways. It can be mentoring the younger or the newer employees. It can be informing a group, employee resource group within your organization that has certain objectives, and part of that objective being mentoring others within the organization to drive themselves towards certain career paths, right? It can be also looking for male allyship. Male allyship is very important. Why? Because if you have those sponsors, especially for the male allies in very senior positions who speak on your behalf, you have a better chance of finding yourself at that table, because you need someone to speak on your behalf and mentor you into a particular role. So it's not a closed space where it's only women who are working with women or mentoring women, but we also need that male allyship, and more so from senior or expert people within a certain space of interest. And that way you're bringing the additional resources into that particular group and mentoring others. It may not and mentoring others, and also creating a space where they can get sponsorship to positions of interest, so long as they meet the merit criteria that is needed. Sometimes, and the reason I speak of also sponsorship other than just mentorship, is that within an organization, you might find yourself that from a merit perspective, you meet the qualifications, but you're invisible in the organization. Why? Because you've not networked internally. So another element just beyond sponsorship is networking within the organization. And you spoke about how do we inspire other people. There are various... The challenge for women is that there's always a boys' club for something, but it's very rare to hear about a girls' club.
Yeah.
And what I want to push as a challenge for women, let's have a girls' club. Let's and I don't mean that we have to borrow from exactly what men do. No, we have other spheres of interest that we have. And within that sphere of interest, there is so much knowledge, experience that you can plug from when you have a certain cohort of women who have common objectives, common goals, common interests. And for those women who are in that position, make it also your mission to inspire a younger generation of women. So having that girls' club, I think is one of the things that we really need to push for, not necessarily adapt what men will do, but also use it as a way of creating a platform to bring in more women into decision-making roles. Speaking for myself, my personal objective is that I never want to be in a space where I'm the only one. I don't like only. Yeah. If I am only, I would want it to be as a means to open a door for another woman to join me. Yeah. So let's get that only mentality out of our minds and create a platform where we sponsor other women or other individuals who are like us to have an entry point into that space that we are in, right? So whether it is around innovation, whether it's in around a space around leadership, whether it's a particular career direction, we can do that. And one of the things that I like doing whenever I meet a group of medical students is I remind them I'm an anesthesiologist. That is the one thing in my heart, being an anesthesiologist. But I also have other skills and other areas of interest that I've ventured into where I am able to impact my knowledge to provide solutions or impact or create some level of impact that may not necessarily be limiting me to anesthesiology, right? So to the younger generation, regardless of gender, who have interests in other fields besides their core training, I think it's important for them to understand that we are multifaceted individuals, and it's good to have that courage to try on new things. Yeah, to go out there. If I'm a medical doctor, why can't I get into software development? I can. It's a skill I can learn, right? And develop solutions that are more geared towards what I have seen during my clinical practice, or be part of a research team that develops work, and I can bring in input based on my experience as a clinician and the challenges and priorities I faced where I worked. So you can see there's a wealth of experience, knowledge, inputs that you can bring in when you open up your mind to think more broadly and not close yourself to only focusing on a certain, just one particular career path. And so for women, I feel if we have an interest in a particular area where it's very rare to find other women, get a male ally, or secondly, look for a mentor from someone who looks like you, who speaks like you, who understands you or your challenges, who understands your journey, and they can mentor you on how to grow into who they currently are, or open up a platform where you can also find yourself in.
Wow, that was.
I know it was a lot.
No, but that was good. I particularly loved the only. You don't want to be the only, and I think that's it's a goal that we should all have. I think, and I think once we have that goal, it will drive a lot of our decision in advocating for women advancement and equality generally in all the spaces that we're in. So thank you so much for this beautiful conversation. You have given me a lot to think about, and I think initially we started with the question. I said I'll bring it to you towards the end, the 111.
Yes.
The book, The Habit, and the value. So what is the one book that you have read at some point in your life that you say, you know what, I wish I had read this book earlier? What's the one habit that you practice that you say, I wish I had started earlier? And what is the one personal value that you will not compromise no matter the cost? Okay.
So on the book, my favorite book of all times is The Atomic Habits by James Clear. James Clear. And I wish I read that as soon as I could read, probably in kindergarten. Then my life would be so much easier in developing habits. I absolutely love that book. In terms of habits, I wish I started journaling earlier, then developed it as a habit, because it's a way of helping me look into what I'm doing, learn retrospectively, and also plan ahead. So journaling is something I started, and I wish I started earlier. And then finally, the one value that I hold most closest to my heart, and I try to interact with people who hold the same value, is integrity. I do what I say, and I say what I do. Integrity for me and having people around me whose word is their honor is incredibly important. Yeah.
Wow. What a way to close it out.
Yes.
Integrity. And I love that, because I think it holds everything you've said together, and it creates a sense of consistency around how you show up in the world. Thank you so much for making the time to have this conversation with me, and for inspiring and speaking into the lives of our audience.
Thank you for having me.
And to our dear audience, this has been the WomenLift podcast. I'm your host, Ben Owden.